Two questions, and I'd like to go along the panel. And Lisa, I'm going to start with you, and then we'll go back
I knew you were going to start with me.
the other way. My first question is, with everything, not only that you said personally, as you all think about this, but as you heard others today, what is the one major recommendation you would make to a policymaker, and particularly someone like the UN, the WHO, these large organizations that have perhaps the power to think differently about the future? What would it be for you?
Can't I say 6?
Try and keep it to one if you can.
Keep it to one, yeah. I think first, separate health and aging, because if we only see aging through the lens of health and health through the lens of aging, we're only going to view it as a problem. Whereas I think Charlotte is 100 million% right. It's an opportunity, and people want it to be an opportunity. So let's look at separating those two things, and just look at the stages that people go through in life and what that brings to them.
Great, love that. So Scott, same question for you.
Yeah, I would agree that the idea of separating this concept of sort of health and consumer is really important, but I think the principles kind of go back and forth. One thing that we didn't touch on very much today is the impact of Alzheimer's and dementia, not just here in the US, but around the world. That is such a massive challenge globally that it would be great if we could really come together and identify different strategies that are holistic in their approach, as opposed to just either product or medical. But that's one that I would definitely call out.
And it's for the older adult and their caregiver, of course.
Very much so.
They're as worried as they are. Charlotte, for you.
Well, I liked everything the people said, but if I would just add one, bringing together, dementia and ageism, is hearing. I cannot believe that in this day and age, we are not addressing hearing loss. It's just invisible. It's a disability, and yet hearing, Helen Keller said it best, that blindness separates people from things. Deafness separates people from people. And the power of feeling good about yourself, connection, social, so matters when you can hear. And it is such a huge contributor to dementia. And we just finished a survey at AARP. We haven't, it just came out last week. But do you know 41% of people have had colonoscopy that are 50 and older? But only like 17-20% have ever had their hearing tested. Okay, that does not speak well to where our future from brain health, from social interaction, from self-perception of aging.
Very good, thank you. Ravi, same question.
I think many of you have heard me say this expression, we've got to redefine what we're doing as engaged, active living with purpose. And I would look to legislators and governments to find a way to make purpose possible in the lives of older adults. Remove the word retirement and remove the age requirement for retirement everywhere. Give them incentives to go ahead and make sure that people that are productive can be productive. So I think it's just fundamentally altering that nature of what you define as old age. I sound like a politician. You want to remove the problems associated with any potential old age, just redefine old age. But that's really what I'm saying, is if you just redefine it, then I think that's really could make some fundamental differences.
Sure.
Just to add to that, Ravi, I think you're spot on. And I think there's an incumbent responsibility on all of us to be the people to educate the policymakers. There's so much turnover at the federal and state and local level that about the time people start to understand what we're talking about, the faces all change. So this is not a one and done. This is an ongoing process of re-educating, and I think we need to be very rigorous about how we do that.
Yep.
Charlotte, maybe you could draft everybody here into the lobbying sessions for Congress and state
Yeah, if we can change the cost of drugs, we can change the view of aging.
So keeping going, and Ravi, this time I'm just going to start with you, and we'll go very quickly along the line, and we'll call it quits for this session. That same advice, but now think in your lens about the entrepreneur. We know we need more entrepreneurs in this space, more people innovating. The theme of our session has been innovation in this area. In what one area, even if it's in a similar area, would you encourage them to contribute the most?
You mean entrepreneurs to
Entrepreneurs, yeah.
enabling the caregiver in many ways, because no matter what we say about what we should have, today we have a problem in terms of finding the resources to address the requirements. And I think if we were to do that, enabling the caregiver is an area that I would advise entrepreneurs to contribute, yeah.
Very good. Charlotte, same question.
So I totally agree with that. So coming up with something different, it's mobility. That independence to leave your home so matters. It's cognition, it's hearing loss, but frankly, the ability to move and be out of the house and interact with others.
Yeah, it's a huge one.
We haven't changed wheelchairs, walkers in decades.
Canes even.
Canes. You haven't seen my cane. So if you saw my cane, you'd know what I'm talking about. But
Very good. Scott, same question.
It's got lasers built in.
Scale. The same entrepreneurs who came up with the Airbnbs and the Ubers, we need entrepreneurs to think about developing things that will scale exponentially. So much of what we see as investors in our funds are nice solutions that have limited applicability for older adults. And there's lots and lots of point solutions like that being developed around the world. But we really need people to think about scale.
Yeah. Okay, very good. Lisa, last but not least.
Maybe I'm going a bit left field here, but kind of financial decision making in older life, with now composite careers. So the Gen Xers who in the UK are about, I think the oldest ones of those are 58, 59. They're just going into this age group. They will have had multiple composite careers with DC pensions, and they will be asked to make quite complex decisions right into their 80s. And how do we facilitate that and gamify the decisions for them? So there's a big role to play in AgeTech and FinTech coming together, I think, for financial decision making.
It's a big trend. Very good.
I just want to contribute one thing to that. It's my dad's 93, and he's like, can they make it so I don't have to file taxes anymore at 93?
Yeah, very good. Well, thank you very much. I know this was a short panel in the interest of catching up on time. Can we please show some appreciation for everyone on the panel and Brad, who can't be here? Thank you very much, folks.